If you work with acupuncture, muscle contractures is something that you will see a lot. A lot of patients come to us because they have muscle contractures, mainly in the back, and most acupuncturists struggle a lot to treat this problem. In my opinion, contractures are, in most of the cases, very easy to treat if you know how to approach the proper technique, but if you don't know how to do it, you will struggle a lot to get consistent results. First of all, what is a contracture or a muscle contracture? Well, this is a spot where muscle tension accumulated, the fibers shorten and the muscle contracts, and you get a small knot there. In most cases you can feel it. If you run your hand through the area where there's a contracture, you will feel a small ball in the muscle. This is usually painful, and depending on how inflamed and where the contracture is, it might even impact the patient. So this is a problem that, not being life-threatening, is usually very uncomfortable for the patient. If you deal with athletes, I'm sure you've seen this a lot, but it's not a problem that's exclusive to athletes. A lot of different people might come to your office with problems like this. Regular people who just try to do something that required a bit more strength than they used to, and they get a contracture. If you like this kind of content and you want to learn more about the techniques I show in my videos, check out the courses I have available. The links are in the description. I have courses available in Portuguese and also in English. Usually most contractures are along the back, so for acupuncturists along the bladder system. You can have contractures in other muscles like your legs or your arm. A contracture usually forms when you need to use more strength than your muscle is used to and is actually capable of. So the muscle will contract so you can do that effort, but when it's time to release, it can't fully release, and one area of the muscle will remain contracted. This usually starts with localized muscle tension, and as time goes on, develops into a real contracture where you actually feel the knot on the muscle. As I said before, although this is not life-threatening, it can be a huge problem for the patient because it can impair mobility, it can stop them from doing certain activities because they have pain, it can leave them very uncomfortable. Some patients can't sleep because they have contractures along their cervical area. So this is something that you should be able to solve for your patients. And in most cases, when using the proper technique, you can get really quick results. And the main problem I see is the approach that most people take when treating contractures. First of all, they think that you need a localized action and a rough action. In most cases, if you look at what physiotherapists do or what massage therapists do, they will do heavy massage in the area of the contracture. So they will press on it, press hard. This is, in most cases, not a solution. Most patients will feel some relief right after the treatment, but 1-2 days after the treatment is done, everything will come back, sometimes even worse. And why is this? First of all, if you're doing heavy massage on an area that's inflamed, you're going to increase inflammation. And if you have muscle tension and you're going to press and create pain on your patient, what will this do? What's the natural reaction when you feel something pressing against you and causing you pain? Is a reaction from the wood element. You tense up to protect your body from what's hurting it. So if you're pressing hard on an area that's already contracted, your patient's reaction will be to contract the muscle, and this in the long term will not solve the contracture. Another very common solution that I see people trying to use is electrical acupuncture. So they will do acupuncture around the area of the contracture and do electrical stimulation. In some cases this works, but in most cases, especially if it's a contracture that's been there for a long time, and when I say a long time, it doesn't have to be years, it might be a few weeks to a few months. Usually electrical stimulation might help, but will not solve it, or will take a lot of sessions to solve. And the same with cupping in the area. Usually you have an improvement during the session and a few hours after the session, but in 1-2 days everything starts to come back. And in my opinion, the only thing that gives us consistent results that work on most cases is the balance method. I've tried and tested a lot of different methods because I work with a lot of athletes, so I see a lot of people with contractures, and the only thing that gave me good results is the balance method. But I'm sure that if you talk to most balance method practitioners, they will tell you, well, sometimes it works and sometimes it doesn't. And the key to solving this riddle is something that a lot of people overlook when they're using balance method and even master tongue acupuncture, which is, which tissue are you needling? There's a very important concept within the balance method and master tongue acupuncture, which is self-treats self, meaning that one tissue will treat itself. What do I mean by this? I mean that if you want to treat a tendon, you need to insert a needle in a place where there's a tendon. And this is still speaking about distal acupuncture. So let's say that I want to treat the Achilles tendon. I might choose a point in the area of the wrist where I have a tendon here. The same thing if I want to treat bone, I want my needle to touch bone. So if I want to treat the spine, maybe I will use a point on the arm that allows me to touch the humerus. And the same is true if you want to treat muscle. If you want to treat muscle, you need to insert the needle in an area where there's a lot of muscle. And this is where I think most people fail when treating contractures with the balance method, or when trying to treat them, actually. And let's analyze a clinical case and see what I mean by it. This is an interesting case because it was brought to me actually by a physiotherapist, and this physiotherapist brought me his mother, who was suffering from contractures around the area of the scapula, which is unfortunately one of the most common areas for contractures and also one of the hardest areas to treat usually. So he brought me his mother because he tried to treat her, it wouldn't go away, it was starting to impair her, the movement of her arm, it was creating a lot of pain, a lot of discomfort, she wasn't sleeping well, and he didn't know what else to do, so he decided to try acupuncture, and he brought his mother to me. This was a 62-year-old female patient, and as I said, the contractures were around the scapula on her right side, so more or less this area over here. If you're thinking about balance method, 1, 2, 3, step number 1 is what's the affected channel. So this area, obviously, we have the bladder as the affected channel. And this would be step number 1. Step number 2 would be what channels can balance the bladder. And let's analyze all the possibilities. So in step number 2, we have that in system number 1, the small intestine balances the bladder. System number 2, the lung. System number 3, the kidney. System number 4, it's the lung again. And system number 5, it's the small intestine again. And now we need to think about the images. Where would we be inserting the needles if we used each of these treatments? For now, I will already eliminate the kidney because I wanted to treat using the arm. So I was left with the small intestine and with the lung. So if we think about the possible images, if we start with a straight image or a regular image, we'll have here the arm where the hand would represent the head. Here you'd have the line of the neck. Going down through the arm, you'd have all the torso, and around the area of the elbow, you'd have the umbilicus. So if we think about where are our problems, well, they're about 1/3 of the way down from the neck to the area of the umbilicus, right? So we divide this and we would work more or less in this area. And now let's analyze our possibilities. As I said, according to the balance method, we could be treating using the lung, or we could be treating using the small intestine, right? But now think about what I told you regarding the tissue where we're inserting the needle. Here, in our patient, we're trying to treat a muscle. So I need to look for an area where there's a lot of muscle. If I go to the small intestine, I'll have some muscle, but I'll be mainly over the bone. This is not what I want to treat. On the other side, if we look at the lung in this area, you'll see that it's mainly a muscle area. So you can insert a needle deep into the muscle of the arm, and that's exactly what you want for a treatment like this. So what I did is I palpated the lung channel on both sides of the patient, because as this is system number 2, if you remember well, you can treat either the same side of the pain or the opposite side of the pain. And what I found was that on the right side, so the same side as the patient had the pain, not only was the channel very sensitive, but you could feel almost small nodules around the channel, as if there were contractures in the same area that represented the area affected by the real contractures. So I searched all this area and I needled every one of these small nodules that were painful for the patient. After 3 or 4 needles, I asked the patient to move her arm and to test how was the feeling on her back, and she told me that there was almost no pain. I looked at her son, who was sitting next to the patient, and he was looking almost in disbelief, like, well, he tried so many different things and nothing worked, and now with 3 or 4 needles in her arm and she was feeling improvement. So I asked him, well, you've massaged it, right? You know where the contractures are? And he said yes. I said, find the contractures and tell me what they're feeling like right now. Again, he looked at me sideways, but he put his hand on his mother's back, he started looking, and then he looks at me amazed and he says, I almost can't find them anymore. Some of them are still there, but a lot softer and a lot smaller. I said, yeah, that's what acupuncture does. But he goes, but this makes no sense. You're not working locally. It's way too fast. And I explained to him that this is how the balance method works, that we know which channels balance which and which images work, and that we're promoting the relaxation of the muscle and trying to take away all the inflammation. After 30 minutes, I removed the needles, and as the physiotherapist had said, that there were still signs of the contractures, but much smaller and not as tense and without any pain. So to finish the treatment, what I did was an application of Japanese moxa. I used a tool called the ontake. If you don't know what it is, you can see here what an ontake is. This is a small bamboo tube, which is hollow, and that you can fill with moxa. You light it, and then you can do a light massage on the affected area using the heat from the moxa directed with the ontake. And this is very helpful to promote muscle relaxation and particularly to release the fascial tissue. Because if you have a contracture for a long time, you're probably not only having muscle problems, but also the fascia around the muscle will be all tight. So I did a massage with ontake for about 5 minutes, and then I asked again the patient to feel how it was. She felt 100%. I tried to feel for the contractures. I couldn't find them anymore, and I asked her son to try it. He also couldn't find the contractures. So we finished the session there. I didn't book a second session, but I told him I will call you in 3 or 4 days to see how your mother's feeling. If the contractures don't come back and she doesn't feel any pain, there's no need to do a second session. If there's still some lingering pain, then we can do a second session. So I called him the next week, and there were absolutely no more symptoms. Again, this is a very simple application of the balance method. The only difference is to focus on the details. It's very easy to just, okay, blindly use system 1, system 2, but if you have this reasoning of what kind of tissue am I inserting the needle in and what kind of tissue do I want to treat, this will improve your results greatly. Focus on the tissue, focus on these small but very important details, and I guarantee that you will see an improvement in your results when applying the Balance Method and also Master Tongue Acupuncture. Thank you so much for watching. If you liked it, don't forget to like and subscribe to the channel, and also share this video with anyone that might benefit from it, and I'll see you in the next one.